This is Fungi, and today I'm here to perform a skill on IVPB, initiating secondary infusion. So for this patient, the doctor's orders, he's ordered vancomycin 750 milligrams, which is an antibiotic. So prior to going into my patient's room, I need to check that the medication that has been ordered is compatible with whatever solution is running into this IV. And in this case, it is compatible. But if it was not going to be compatible, I would have to temporarily disconnect whatever is running into the IV and put and connect another primary which is compatible with the medication. So I have to perform the 6 rise to medication and to do my checks on the medication. So I'm going to check if I've got the right medication, and I'm going to compare that with the MA. I'm also going to check the expiry date on the medication, and it's not expired. So then I proceed to gather all my supplies. In this case, I need alcohol swabs, and I need a secondary IV tubing kit, which I have here, and I also need in hand a tag that I'll be placing on my secondary tubing with the date and the time that I would have started running the secondary IV. So I go into my patient's room, I introduce myself, and I provide privacy, and I have to check if I've got the right patient. I'm going to ask the patient for their name, date of birth, and then after making sure that I've got the right patient, I have to also inspect the site if there's no infiltration, if there's no redness or soreness, and in this case, this is okay. So I go ahead and spike. I'm going to go ahead and spike my medication using the secondary tubing kit. I'm going to make sure that I take my alcohol swabs and clean the pot that I'll be using, which is directly above the pump. I'm going to clean it for at least 30 seconds. Then I'm going to let it to air dry. After it's dry, I am going to connect it with my tubing from my secondary tubing into the pot. Everything is connected. I make sure that all the clamps are closed. Then after it's connected, I'm going to do a backflow of the medication by just placing this secondary tubing right below the primary bag. Then I'm going to let it flow. I'm going to open the clamp, and it's going to backflow into the priming by letting it temporarily make by allowing the primary solution to flow back into the bag, secondary tubing bag. And I'm going to let it just go into the chamber for at least a third, up to a third. And once that's done, I'm going to close the clamp. The piggyback right above the primary, so that the secondary is going to be hanging above the primary. So I make sure that I've connected everything. I make sure that I program the settings to the device. After making sure that the program is running, I'm going to open the clamp to the secondary bag tubing so that it flows. Then I'm going to check if the infusion rate has resumed and is set at the rate for the medication to flow. Then after that, I am going to I'm just going to make sure that everything is flowing smooth and is fine. Then after that, once the medication is finished and I have to run another bag, I have to make sure that the same, if I'm going to be using the same secondary tubing, the medication is the same. And if it's not, I'm going to start the whole process again, because I cannot use the same different medications with the same port. So I'm going to change the whole tubing and make sure I connect it the same process that I just did with this one. But if it's not, then I just discard the whole tubing and the bag. Then I make sure I reprogram the device to its normal running flow. And then after that, I'm going to check, just to check if the patient is okay, no infiltration, no irritation, redness, or anything to the site. And after that, I am just going to document. I'm just going to document on everything that I've done, including the time that I would have put on the secondary tubing. And I'm also going to document if the patient had any reactions or anything. Then yeah, that's it. I'm going to wash my hands, make sure my patient is fine, and that's the end of my video. Thank you.